Every year, more than 1 million people across the globe are diagnosed with one of the most prevalent types of cancer, blood cancer. And in the U.S., the Leukemia and Lymphoma Society estimates more than 1.6 million people are living with or are in remission from different types of blood cancers. Joining us today is Dr. Caleb Scheckel, an oncologist with Ascension St John, also Oklahoma Cancer Specialists and Research Institute.
That's
Did I get
correct.
it right?
You got
All right.
it.
I practiced it like 5 times during the break. Thank you so much for being here this afternoon.
Absolutely.
So let's dive right in. Just how common are blood cancers, and why is it important to talk about it, raise awareness about it?
Great question. So September is Blood Cancer Awareness Month, and blood cancers represent approximately 10% of cancers overall. And so patients being aware of what signs to look for, when they should see a doctor, incredibly important.
And it's not just one kind. There are several kinds. Your specialty is leukemia and lymphoma. Tell me more about the different kinds that there are.
Yeah, so there are many different types of blood cancers. Leukemia and lymphoma being some of the most common, multiple myeloma being another one that's incredibly common. These are the ones that really come to people's minds, but there are many different subtypes and a lot of variety within those diseases too.
Sure, so what would the symptoms look like for a type of blood cancer?
Yeah, so I think symptoms that people need to be on the lookout for is unintentional weight loss, drenching night sweats, rapid onset of worsening bleeding and bruising that's unexplained from like an accident or an injury, swelling in the neck or under the armpits or even in the groin could be signs of enlarging lymph nodes. These would be the sort of symptoms I was just going and seeing your primary care doctor about and exploring those further.
And you just mentioned, when would be the time to reach out to your doctor? If you notice a swelling, is it associated with pain, or you just notice that it's
Sometimes
enlarged?
it can be associated with pain, but usually it's painless swelling in the lymph nodes. And many times, even after if we get like an upper respiratory infection or like a tooth infection, we can see a temporary swelling in lymph nodes, but really be worried if we see that swelling come and then persist more than a couple of weeks.
What would the diagnosis process look like? Is it as simple as a blood test, or is there more testing that goes into it? When you notice signs of, okay, I think there might be something going on, from then getting an official diagnosis, how long would that take?
That's a great question. So for many people, they're going to start off by seeing their primary care doctor and getting some blood tests. And then depending on what those show, it'd be quite possible that they may even get a biopsy of a lymph node. Usually that could be a pretty non-invasive procedure to do, and just try to get some more answers and kind of guide where do we go from here.
Sure. Well, oftentimes you think of the big C word, there's a lot of fear that surrounds it. But the whole point of talking about awareness, and there is research, there's a lot of work being done. What does prognosis look like? What does that conversation look like with patients who are filled with so much fear?
Yeah, exactly as you said. You know, cancer as a diagnosis is very frightening, and that's to be expected. But, you know, I also want to give a lot of hope that there's been a lot of advances in the science, a lot of advances in research, even in the past decade. And so people are living longer and doing better. And also certain types of blood cancers we can even cure. And so, you know, anytime that there's a concern, having someone come see me talking about what's involved in this particular type of cancer, how are we going to approach this? Is this something that we can potentially cure, or what are the new options that are coming out? Clinical trials are enrolling people all the time, and we just have a lot more to offer patients these days.
Absolutely. There's a lot of reasons to have hope.
Yes.
And that's where you come in.
Yes.
Thank you so much for your time this afternoon.
All right, thank you.